How do you coordinate dental care before or after chemotherapy or radiation? If you're undergoing chemotherapy or you've had chemotherapy and you've had this unfortunate journey, you're decay prone, your salivary glands don't work. Well, your gums are so bright and red from that dryness they experience. The last thing we want to do is put a denture on there. So some people tough it out and they go without. And it's unfortunate to live life without getting that satisfaction of chewing a meal. I had an 80-year-old patient tell me chewing replaces sex. This is a true story. And that it's gratifying in your 80s to chew well again. And I thought that was an interesting take on it. But nevertheless, if we take away your ability to nourish yourself as we get older, you've had cancer, you've dealt with chemotherapy, you've dealt with the radiation, then that dry mucosa, we don't want to put a denture on that. So implants become the right treatment option if we haven't had a total dose of radiation that's too high in your jaws. So that's a number we need to find out about.